What's become known as the Omicron variant was first detected in southern Africa back in November. Within 2 weeks, it had spread to the rest of the world.
It's a new year, but with cases soaring to new records, it doesn't exactly feel like a fresh start.
The Omicron variant is causing skyrocketing rates of COVID-19 infections in countries around the world.
The UK, South Africa, France and Italy reported the highest daily cases of the entire pandemic.
A significant reason for the massive Omicron surge is that the variant has partially evaded past immunity. The parts of the immune system which protect us against severe disease are the T cells, which can attack infected tissue directly. And vaccine research in Southern California and many other places has found the news is good when it comes to T-cell immunity against Omicron.
While the antibody response is much decreased at the level of neutralizing activity, the T-cell response is conserved. This would mean that the virus would have an increased capacity to infect people. So the vaccine would not be as effective in preventing infection, but if the T cells are there, they still would be able to prevent severe disease and eliminate the infection.
The evidence from the UK is that the Omicron virus has about a third of the risk of hospital admission compared to Delta.
The Omicron variant has a very strong capacity of infecting cells of the upper respiratory tract, but have decreased capacity of infecting cells in the lung. So if the virus has less capacity to go down to the lungs and it's more circumscribed to the upper respiratory tract, this is potentially very, very impactful in terms of giving less severe disease.
The number of cases in Australia has moved into rapid exponential growth. But with the changed access to PCR tests, that's almost certainly an underestimate.
We probably are not ascertaining, getting to all of the cases, so there's probably more disease in the community than the numbers reflect.
With such a high number of cases now in our community, we have to assume, if we're symptomatic, that we're probably contracting COVID.
One measure of the cases you might be missing is the proportion of tests which are positive. You want that to be as low as possible, meaning the vast majority of people tested should be negative. Throughout the pandemic, we've rarely gone above 1%. New South Wales at the moment is more than 20%. And that suggests the real number of total infections is much higher.
Based on evidence from overseas and our experience with the 2020 sero surveys when the positivity detection rate was very low, I don't think it's unreasonable to speculate that at this point we're missing at least 2/3, if not 4/5 of the cases. So a 3-fold or 5-fold underdetection rate.
That's why a lot of us now know somebody with COVID. With that underdetection rate, there could be 1 million weekly infections right now. But what everyone around the globe is watching with some anxiety is the burden of the current surge on hospitals. Even with boosters restoring a lot of protection, less severe disease with Omicron doesn't mean we're out of the woods.
It is very important to consider there is a numbers game. So it is true that the virus is linked to less severe infections, but in relative terms. So if the virus is linked to, say, 5-fold decrease in hospitalization, but the number of infection goes up 50-fold, that could still completely overwhelm the system. And this is a reason for getting vaccinated and continuing to employ measures such as masking, distancing, and so forth that can be effective in reducing the absolute number of infections.
Hospital and ICU numbers are growing, although those in ICU are mostly unvaccinated and infected with Delta. System stress is made worse because healthcare workers are being infected themselves and therefore put on furlough.
The objective now is really to make sure that as few people as possible end up getting sick and end up in hospital, let alone into the intensive care units, so that it maintains a manageable impact on the health system.
Now, with hundreds of thousands of cases in New South Wales, it is possibly too late to do anything other than a major lockdown in order to flatten the curve. We know Dominic Perrottet will not do that, until the system goes into complete meltdown. And unfortunately, the most likely scenario is that that's what it will take for this government in New South Wales to actually change its approach.
To be in a position in New South Wales with such a low death rate, to have a strong economy, as we open up, we are leading the nation out of the pandemic. And obviously, with significant case numbers, people will be anxious across our state. But we will stand strong, just like we have over the last 2 years, and get through this challenging time as well.
Some commentators are saying that Omicron marks the end of the pandemic. The question is whether that's likely or just wishful thinking.
We certainly should be humble. This virus has surprised us. I don't think any of us would have guessed we'd be third year into the pandemic. So this virus continues to surprise us.
We've seen time and time again that the pandemic takes twists and turns that we don't easily predict, and I think we make assumptions about it at our peril.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.